we look at what's happened in the last 18 months, we've seen a pandemic that shut down the world, one small virus. But we've found, through enormous commitment of energy, expertise and resources, a solution to that in the form of a vaccine program which is rolling out and in form of the public health responses that have occurred through 2020. And Australia has been extraordinarily successful at that. We've been motivated, we've committed expertise, and we've seen that expertise guide public policy. That same formula can work when it comes to climate change. The evidence is clear, the things that we can do are clear, and now the challenge is for us to do it, to be motivated enough to put those policies into practice, to reduce the emissions that are contributing to climate change and help this planet repair. For example, if we take into consideration the impact of the healthcare system in Australia, if we gather together that enormous industry that is healthcare in Australia, it accounts for probably a similar emission contribution to that of the state of South Australia, roughly 7% of total emissions. So that's an enormous window of opportunity where the people who are likely to be treating the adverse impact of climate change, which has already started, as a system can contribute to the solution. So there's a lot of fundamentally important choices that each of those individual institutions need to make to ensure they reduce their footprint, to ensure that the future of the planet and the people on it they're meant to be serving actually do have a future. PHAA has always been established to prosecute public health policies, and that is to influence governments at state, local and national level to operate policies and practices through the powers they have to influence outcomes for people. But more importantly, our responsibility is to draw to the attention of all policy and decision makers the impact of climate change with regard specifically to health.